We have many patients that come into the clinic that have been suffering from, back pain for many years already, and they say, hey, I'm gonna be on pain meds for the rest of my life. I'm gonna need injections, nerve blocks. Who knows? I may need even back surgery down the road, and they really are not knowing what physical therapy can provide for them. One of the things that we can provide here in physical therapy that we let our patients know and educate them on, that we can start by gently, passively moving their joints of their back, the hip, the knee, to slowly increase that mobility. Each of our patients have tailored made care plans for them to help strengthen, help stabilize, and increase stability in the muscles and decrease their pain levels slowly but surely. With this increased strength and stability that our patients are slowly gaining, they're getting improvement in their balance, they're getting improvement in their posture and core control. And what we are wanting to show our patients, that they do not need to be afraid to move, and so they're gaining that confidence again to move again without fear. Our patients are very active in goal setting. We want to know what they want to get back to, whether it's playing with their kids or grandkids, being able to do chores around the house without any pain. These functional goals and outcomes is what we hope to continue to achieve and help bring back that quality of life to our patients again. It's very important that our patients are able to play with their kids and grandkids again and do what they love. Lastly, hopefully as we decrease their pain level, we gain that strength, stability, and educate our patients what they can do when they get discharged from physical therapy. We in turn can save them money, where they are not going to need that continued reliance on their pain meds or the injection or costly surgery here. And that's what we hope to provide our patients.